Critical assignment: access to healthcare. Martin Cazares, August 22nd, 2019. Introduction. The contemporary health issue covered in the following slides, and the one I have chosen to research, identify, and create my critical assignment, contemporary health issue presentation, is access to healthcare. I will cover the following topics: summary of the issue, current event / hot buttons, relevant risk factors / preventive techniques, applications / relationships to the public health, and alternatives to consider. Summary of the main issues. The main issues include access to providers, access to facilities, treatments, and healthcare quality. Quote, "The most significant factors in determining access to healthcare are the supply and proximity of providers and facilities and availability of insurance coverage." End quote. Donatil, 2017. Access to providers. The different types of health insurance include private health insurance, managed care, and government-funded programs. The government-funded programs include Medicare, Advantage, Part D Medicare, and Medicaid. Although people might have health insurance, their managed care plans might restrict who they can get treatment from. Which leads me to my second main issue: access to facilities. Access to facilities. As previously mentioned, the lack of facilities in rural areas restricts the availability to obtain health services. Furthermore, many of the non-government hospitals in the United States are located in or near urban areas. Affordable treatments. Under insurance, quote, "the inability to pay out-of-pocket expenses despite having insurance," end quote. Donatil, 2017. Without access to affordable health care, people run the risk of getting into debt. Some people don't have the capability to implement preventive measures, which could lead to an increase in fatality rates. Main issue continued. Access to quality health insurance. In America, not everybody has the same level or type of insurance, and unfortunately, not everyone gets the same level of treatment. One of the goals of the Affordable Care Act, ACA, was to increase the access to quality health insurance. Furthermore, insurance providers were now required to cover several preventive measures. Some of these treatments included screening for cancer, screening for cardiovascular diseases, and counseling. To ensure a quality standard, healthcare providers are evaluated based on education, certifications, accreditations, and a legal system of malpractice litigation. Additionally, in order to establish a desired level of quality, the Federal Drug Administration, FDA, must approve prescriptions and medical devices. Current events. The topic of having access to healthcare in America has been in the forefront of most Americans, and has recently been discussed in political events such as presidential campaigns and changes in legislation. Important changes and controversies. In 2010, Congress passed the Affordable Care Act, ACA. In order to increase the accessibility of healthcare, the ACA encouraged primary care providers to establish new facilities in rural areas. Additionally, in order to increase the access of healthcare, the ACA invested in new care training programs such as Graduate Medical Education Program and National Health Service Corps. Throughout the increase in funding, of medical training programs, the ACA increased the number of primary care providers. Additionally, the ACA also supported mental and behavioral health training in order to increase the number of those practicing mental and behavioral health. Hot buttons. There is a correlation between delayed healthcare and increase in mortality rates. Cost is a major hot button since the United States of America spends more on healthcare than any other country per capita as a percentage of their GDP. Political pressures. There are federal and state level regulations for insurance coverage for both public and private. Additionally, there has been attempts to repeal and replace the Affordable Health Care Act. Unfortunately, this could result in lower number of people having access to health care. Another hot button is the cost of health care. Relevant risk factors and prevention techniques. One of the arguments for affordable health care is that access to health care should promote healthier lifestyles. The public could take advantage of preventive medicines and the available knowledge to make well-educated decisions on their health lifestyles. As previously mentioned, there is a correlation between delayed health care and the increase in mortality rates. Quote, prompt access to primary health care before onset of severe illness is vital to improve morbidity and mortality rates. Reese, 2016. Another preventive technique would be the education of young adults. Quote, health professionals and health education specialists should continue to develop health promotion campaigns to educate young adults about the importance of prevention and utilization of preventive care beyond basic health screening and yearly checkups. End quote. Luquis, 2017. Applications and relationships to public health. Strategies currently utilized include private insurance and the Affordable Health Care Act. People can choose not to have health insurance, but they will have to pay a fee. Alternatives to consider. Legislative actions can restrict the price change for healthcare. However, there is some pushback on this possibility because the United States would have to get involved and create restrictions for what has previously been a free market industry. On the other hand, if the government does get involved, they could create healthy competition between healthcare providers. And the last alternative would be having the federal government offer universal healthcare. In conclusion, access to healthcare would benefit the American people, but it requires an increase in access to providers, facilities, treatments, and healthcare quality. Recommendations. States could take the initiative and educate the residents. Additionally, the state's representatives can create legislation that would create healthcare standards that would cover most preventive measures. These preventive measures can include access to knowledge, screening, and vaccines. The states that incorporate these initiatives would be role models to the federal government and other states. Things to think about. The two requirements that stood out to me the most in the ACA is the no annual and lifetime limits on benefits are allowed, and that coverage could not be denied to patients with pre-existing conditions. Quote, pre-existing conditions place one limited the insurance company's liability for medical conditions that a customer had before obtaining coverage. Under the 2010 Patient Protection and Affordable Care Act, no one can be discriminated against due to pre-existing conditions. End quote. There should be strict guidelines on what is considered preventive and what is cosmetic healthcare. The responsibility of providing healthcare would create a monetary demand. Therefore, the states and federal government would have to incorporate this demand into their budget, which would ultimately translate to the general public through paying higher taxes.